16 people have become the latest victims of COVID-19 in Jamaica, as 287 more people tested positive for the virus yesterday. Clinical coordinator at the Cornwall Regional Hospital in Montego Bay, Dr. Delroy Frey, says the 3-weekend lockdown announced by the Prime Minister must have some benefits.
It's hard to quantify what 3 weeks lockdown would do. It's hard to quantify it from a statistical point of view, but I'm sure it must have some benefits.
Ministry of Health and Wellness on Saturday vaccinated approximately 612 persons over 75 years old with the first dose of the COVID-19 vaccine manufactured by AstraZeneca at the National Arena in Kingston. And students in the Cocoon community in Hanover are being provided with daily breakfast as part of an initiative to help provide healthy nutrition.
This breakfast program will be something to remember because we're in a situation now, the pandemic, where food is in short supply, resources are in short supply, and the little we have, we try to extend to those that are in need.
Good evening. 16 people have become the latest victims of COVID-19 in Jamaica, as 287 more persons tested positive for the virus yesterday. This pushes the country's death toll to 586 and the total number of confirmed cases to 38,514. According to the Ministry of Health and Wellness, 14 of the deaths were recorded in Kingston and St. Andrew. 8 of the victims are women, ages 67, 72, 52, 80, 59, 66, 56, and 78 years old, and 6 are men, ages 88, 68, 68, 79, 37, and 89 years old. 2 of the deaths reported in Kingston and St. Andrew were previously under investigation. An 80-year-old man from St. Catherine and a 62-year-old man from St. James are the other 2 victims. The ministry said the deaths occurred between February 25 and March 26. 3 more deaths were reported as coincidental. Of the 287 newly reported cases, there were 149 females and 138 males with ages ranging from 7 days old to 91 years old. The new cases were recorded in Kingston and St. Andrew with 78, St. James 45, St. Catherine 39, Westmoreland 26, Clarendon 24, St. Anne 15, St. Mary 15, St. Elizabeth 12, Manchester 10, Hanover 9, Portland 8, Trelawney 4, and St. Thomas 2. The country also recorded 137 recoveries, bringing the total number of recoveries to 17,334. Clinical coordinator at the Cornwall Regional Hospital in Montego Bay, Dr. Delroy Frey, in addressing the high level of COVID-19 patients being admitted to the hospital, says the 3-weekend lockdown announced by the Prime Minister must have some benefits.
Any measure that will minimize infection is going to be advantageous to us. So my comment is that if we can minimize overcrowding and ensure that people wear their masks, and I believe that is one of the most effective way of preventing the spread of this infection, will help. I mean, it's hard to quantify what 3 weeks lockdown would do. It's hard to quantify it from a statistical point of view, but I'm sure it must have some benefits. Consistently, we run anywhere between 45, 50, 55 patients admitted for COVID care. And I believe that we are in the peak of the pandemic now. And as you know, COVID patients that present to hospital is really a type of intensive care that they need. So it put a lot of pressure on the the staff, the infectious disease team, and the nurses that looks after these patients. And of course, it uses a lot of resources at it because you have to provide the necessary protective garment for them to work with. So that is a big challenge. And up until now, I'm not seeing that level abating. And I trust that we will see an abatement as soon as possible because it's hard to sustain that intensity of work that it requires.
Dr. Frey further pointed out that the elective surgeries at the hospital have been affected due to the ongoing COVID-19 pandemic and the hospitalization of increase in COVID-19 patients.
In any crisis, you have to adjust your regime to deal with it, the crisis. A lot of our efforts are concentrated on COVID care because we are currently experiencing a pandemic. So the aspect of the hospital that is affected is our elective surgeries. And the elective surgeries are surgeries that can wait, it's not life-threatening. And those surgeries have to wait. So I make a plea to the public that if you need an operation that is not urgent, it's not life-threatening, more than likely you will get a new date to do that. What we try to do is to deal with all the emergencies that presents to us and also the cancer cases, because if those are delayed, it can have an adverse outcome. So we concentrate our efforts in addressing those issues. We still see our patients in the clinic and they are given prescription and they are sorted out. That has to be done because that will avert having to see them in the A&E department with complications of not getting their medications. So our clinics are in operation and we see our patient and treat them accordingly. We prioritize the care that we give so that we don't get adverse outcomes.
The Ministry of Health and Wellness on Saturday vaccinated approximately 612 persons over 75 years old with the first dose of the COVID-19 vaccine manufactured by AstraZeneca at the National Arena in Kingston. A release from the Health Ministry stated that this represented 92% of the persons registered to be inoculated at the site. Among the persons vaccinated were 4 centenarians, including a 102-year-old woman. While the target for the Blitz site operations was 1,000 persons, 662 seniors had registered to be inoculated at the location between 10 a.m. and 3 p.m. Minister of Health and Wellness Dr. Christopher Tufton was pleased with the turnout and also thanked the administrative and clinical team at the ministry and the region for a job well done. Additionally, the minister pointed out that there was tremendous support from the Jamaica Constabulary Force, the Jamaica Defense Force, and the private sector vaccination initiative team, and saluted these partners for their ongoing support of Jamaica's vaccination implementation program. The vaccination blitz at the National Arena was the first in a series planned by the ministry to provide mass vaccination of Jamaicans. The next vaccination blitz operation is planned for Saturday, April 3 at the National Arena. The ministry is reminding the individuals who have been vaccinated with the first dose of the COVID-19 vaccine to continue to observe all the infection prevention and control measures, wearing of a mask, maintaining physical distance of 6 feet or more, and frequently washing hands with soap and water or use hand sanitizers. The Jamaica Constabulary Force is reporting that 7 persons in Milk River, Clarendon are among dozens of other persons charged with breaching the Disaster Risk Management Act during the first weekend phase of the all-island lockdown announced by the government. The police said they have prosecuted several other persons from the corporate area and across Western Jamaica who were found to be in breach of the act between Saturday afternoon into Sunday night. The 7 people who were arrested by the Milk River Police in South Clarendon for disobeying the curfew order which took effect at noon on Saturday are to face court in Clarendon next month for breaches of the Disaster Risk Management Act. Those charged are scheduled to appear in court on April 28. Despite the arrests, the police say there has been general compliance with the curfew. Meanwhile, over in Hanover, commanding officer in charge of the Hanover Police Division, Superintendent Sharon Beeput, reported that 46 persons were arrested and charged, including 5 motorcycles seized over the weekend of lockdown in the parish. Prominent medical doctor Jeffter Ford has died. Ford reportedly passed away at his home yesterday morning. Further details surrounding his death are sketchy at this time. Dr. Ford has been featured in several high-profile cases locally, including as a member of the medical team which observed the autopsy of Jodie and Ferron last year. Ferron, who was 23 years old at the time, died after giving birth to her daughter under controversial circumstances. A probe was subsequently launched into Ferron's death. Meanwhile, as news of Dr. Ford's death emerged, several persons reacted with expressions of condolences on social media. Among them was Minister of Culture, Gender, Entertainment and Sport, Olivia Grange. She posted on Facebook saying, quote, "I am shocked and saddened by the sudden passing of Dr. Jeffter Ford, my good friend. We have lost a Jamaican who truly cared about our people and their well-being," end quote. Meanwhile, the opposition People's National Party, PNP, is expressing profound sadness at the passing of Dr. Jeffter Ford and extends condolences and sympathies to his brother, Dr. Japheth Ford, other relatives and friends. Party leader Mark Golding said, quote, "Dr. Ford was a champion for social justice who represented the People's National Party in Northwest St. Andrew over 3 election cycles. He was also a community physician par excellence. His calling went beyond a distinguished medical field, and he achieved an uncommon convergence of professionalism, advocacy, and public service," end quote. The statement for the PNP went on to express that Dr. Ford was known all across Jamaica and particularly in the corporate area for his courage and his commitment to providing medical services to all. The statement noted he was also courageous in speaking out on matters which affected the rights of the people, even when they were sensitive, unpopular, and controversial. The PNP also said that Dr. Ford's career reflected the principles of Michael Manley. He was kind and accessible, always loyal to the marginalized and the disenfranchised, and he spoke for the people in the communities he served, according to the statement. The PNP concluded that Jamaica has lost a committed medical professional and a special servant of the people. In other news, the St. Andrew North Police are seeking the public's help with an ongoing case as detectives are investigating a case of larceny and malicious destruction of property which occurred along Constant Spring Road in St. Andrew in the vicinity of Mary Brown's Corner, and have obtained CCTV footage of the incident. In the video, the suspect is seen breaking into a motor vehicle. It is reported that approximately 500,000 Jamaican dollars was stolen in the incident at about 9:43 a.m. on Wednesday, March 17. The investigators are now appealing to persons who may be able to help them to identify and or locate the individual in the video to contact them immediately at 876-924-1421. Persons may also call Crime Stop at 311 or the nearest police station. The police is seeking the public's assistance to locate a 32-year-old St. Catherine woman who has been missing since Saturday, March 27. She is Shauna Gale Reed from Waterford, Portmore. The police say Reed was last seen in Waterford about 5:50 a.m. on Saturday. She's of dark complexion, medium built, about 5 feet 3 inches tall. Her mode of dress at the time she went missing is not known. The police are asking anyone knowing her whereabouts to contact the Waterford Police at 876-988-1763, Police 119 emergency number, or the nearest police station. The police is also reporting that 21-year-old Shakira Gale, otherwise called Ashley, of Rose Heights District in St. James, has been missing since Saturday, March 27. She's of dark complexion, slim build, and is about 5 feet 2 inches tall. Reports from the Springmount Police are that Gale was last seen at home about 10 a.m. wearing a blue dress. All efforts to locate her have proven futile. Anyone knowing the whereabouts of Shakira Gale is being asked to contact the Springmount Police at 876-617-9789, Police 119 emergency number, or the nearest police station. Fire of unknown origin completely destroyed a section of the Consumer's Real Choice hardware in Flankers, St. James yesterday and resulted in damages estimated at over $25 million. A female and her baby, who resided on the upstairs of the building, were nearly burnt to death and had to be rescued by residents of the community. Reports by the Coral Gardens Police are that at about 12:30 p.m. on Sunday, residents living at Mackenzie Drive in Flankers saw fire coming from a section of the building and heard the child's mother screaming for help, and they summoned the fire department. The residents attempted to put out the fire with buckets, and when their attempts failed, they forced their way onto the compound and managed to rescue the female and her baby. The firemen then arrived on the scene and managed to put out the blaze, which had already destroyed most of the building and all its content. And those are some of the stories making news. We will return with other stories, with students in the Cocoon community in Hanover being provided with daily breakfast as part of an initiative to help provide healthy nutrition. But first, let's take a break and then join Christopher Scott with sports.